Have you ever considered that a seemingly minor cut or untreated wound could escalate into a life-threatening bone infection? This condition, known as osteomyelitis, is a serious infection that targets the bone and bone marrow. Often caused by bacteria like Staphylococcus aureus, including its resistant form MRSA, or by fungi in individuals with weakened immune systems, osteomyelitis can develop rapidly and silently, leading to severe complications if not promptly addressed. Understanding how this infection infiltrates the bone is crucial for prevention and early detection. My name is Dr. A. I am a board-certified internal medicine physician based in the United States. For the past several years, I have been actively involved in the research and treatment of various medical conditions, with a particular interest in pulmonary diseases. My primary goal is to deliver accurate, evidence-based medical information in a clear and accessible language. I want to empower you to make informed decisions about your health and avoid falling prey to misinformation. Osteomyelitis can reach the bone through various pathways, via the bloodstream from another infected area, from nearby tissue infections, or directly through open wounds or surgical procedures. Certain risk factors increase susceptibility, including diabetes, poor circulation, recent surgeries or trauma, and compromised immune systems due to conditions like HIV or cancer treatments. In adults, the vertebrae are commonly affected, while in children, the long bones such as the femur are more frequently involved. There are different types of osteomyelitis: acute, which develops rapidly; chronic, which persists or recurs over time; vertebral, affecting the spine; and diabetic foot osteomyelitis, prevalent in individuals with poorly managed diabetes. Diabetic foot infections are notably the leading cause of non-traumatic lower limb amputations globally, underscoring the importance of proper diabetes management. Recognizing the signs and symptoms is vital. These may include fever, chills, redness or swelling near a bone, pain that intensifies over time, fatigue, and difficulty moving the affected limb. In chronic cases, fever might be absent, but persistent pain and draining sinuses are common indicators. Prompt medical attention upon noticing these symptoms can significantly improve outcomes. NHS UK +9, AFMC +9, Cleveland Clinic +9. Diagnosing osteomyelitis involves a combination of imaging and laboratory tests. MRI scans are particularly sensitive in detecting early bone infections, while bone biopsies remain the gold standard for identifying the specific causative organisms. Early and accurate diagnosis is essential to prevent the progression of the disease and to initiate appropriate treatment strategies. Early detection is paramount. If left untreated, osteomyelitis can lead to bone destruction, abscess formation, or even sepsis, a potentially fatal systemic infection. In severe cases, surgical intervention or amputation may become necessary. However, with timely antibiotic therapy, the prognosis improves significantly, highlighting the importance of early medical intervention. Treatment typically involves administering potent antibiotics, often intravenously, for several weeks. In some instances, surgical procedures are required to remove necrotic bone tissue or to drain abscesses. The duration and type of treatment depend on the severity and location of the infection, as well as the patient's overall health status. Prevention strategies are equally important. Maintaining proper wound care, managing chronic conditions like diabetes effectively, and adhering to post-surgical care instructions can significantly reduce the risk of developing osteomyelitis. Regular monitoring and prompt attention to any signs of infection are crucial preventive measures. In conclusion, while osteomyelitis is a serious condition, it is both preventable and treatable, especially when identified early. Staying vigilant, practicing good hygiene, and seeking medical advice when necessary are key steps in safeguarding your bone health. Remember, proactive care and informed decisions are your best defenses against such infections.